Hello everyone, my name's Arianelia Locklear, and I'll be talking to you today about Burkholderia pseudomele, the great imitator. In my case study, it taught about the World Health Organization in the UK isolated a bacteria from patients. How they did this was that patients that were sick and showed signs of a disease that the bacteria caused, they took a sample and they isolated the bacteria in that sample. By doing this, we can study the bacteria more closely and also give a diagnosis. So let's talk a little bit about the history. It was discovered in 1911 by a pathologist, Alfred Whitmore, and his assistant. Whitmore discovered the bacteria when he was trying to find another bacteria that caused glanders. When he took a sample from an animal and put it in a culture, he saw he had two strands of bacteria. The bacteria that he didn't recognize had very distinguishable characteristics. He isolated that bacteria and then he put them into animals and saw that animals died pretty quickly. Thus he discovered the new bacteria, Burkholderia pseudomele. But it always wasn't called Burkholderia pseudomele. It was actually called a lot of various other names up until 1992 when it got its official name. But Burkholderia pseudomele actually causes a disease. The disease didn't actually come into scene until about the late 20th century. Melioidosis, the disease that is called by Burkholderia pseudomele. A little bit about the bacteria and what it looks like. As you see in the picture, it is a gram-negative bacteria, which means that during gram staining, it stained red. Also, you can see that it is a rod shape. Most researchers call it the safety pin shape. Burkholderia pseudomele can live in a lot of hostile environments with little to no nutrients. It can also live in humans and animals. But its favorite place to be is in soil and surface water. Here goes a worldwide map of melioidosis cases. I'll zoom in here and you can read the key to the map. White means not recorded, red means endemic, orange means possible endemic, purple means sporadic, green means environmental isolates, and stripe means unconfirmed cases. As I zoom back out, you can see that a lot of the southern countries have possible cases. We even have an unconfirmed case in the United States, but our neighbor below us, Mexico, has sporadic cases. As you look over to Asia and northern Australia, you'll see that they're in an endemic. As mentioned before, the bacteria Burkholderia pseudomele likes warm, moist environments. This can explain why we don't see any in Russia, Alaska, or Canada. Some of the virulence factors is that the bacteria is very slow growing, which makes it very hard to treat. Also, it's antibiotic resistant. Some of the factors that make it antibiotic resistant is the glycolax polysaccharide capsule that is around the bacteria. Also, some of the mechanisms it uses is exclusion, enzymatic inactivation, target mutation, and efflux, which help kicks the antibiotic out. Also, it has endotoxins, which makes us really sick. The endotoxin that it uses is CLT. CLT makes us contract a very strong form of melioidosis. It helps cause sepsis in humans and plays a role in the very high mortality rate that this disease causes. Here goes a chart showing you some of the valerians and the survival. So now we know some of its factors. Is it LD50 or ID50? It's actually LD50. And LD50 means lethal dose. But how do we know about the lethal dose in melioidosis? Well, what we do is we take a certain amount of toxins and apply it to animals. And if it kills half, and whatever amount kills half of the animals, then we have our LD50. So some of the animals that we tested on was mice, hamsters and guinea pigs, and monkeys. In the mice, we actually gave half of them a diabetes injection, giving them diabetes, and the other half was normal. And what we saw was that the mice that had diabetes had a 10 to the 4th LD, while the mice that didn't have anything had 10 to the 8th. Also, we saw was that smaller animals, such as the guinea pigs and the hamsters, had died faster and more than the animals that were bigger. Now we know that size plays a part. But how can we catch melioidosis? How is it transmitted? Well, here I have a picture of a little boy running through a mud puddle. Now remember, the bacteria likes to be in soil and surface water, especially in warm environments. So while he is running in the puddle, let's say that he has a cut on his ankle. Well, since he has a cut on his ankle, he is now exposed to the soil and the water, which has the bacteria in it. Since he'll get the water and the soil in his bacteria, the Burkholderia pseudomylae bacteria will now enter his body. But also, he's kicking up a lot of water droplets and some dust. Now he is inhaling that. He can also catch the disease by that way, inhaling. Another way to catch it is ingestion as well. Human-to-human contact is very rare, but it can happen. So some examples is if you're in a laboratory and you're working with human bodily fluids that has the infection in it, or the bacteria, in it. And let's say that you have an open wound on your hands. Some of the bodily fluids happen to leap up and hit the wound on your hand. Well, now you have the bacteria going through your body, and you can catch disease melioidosis. Another example is rice farmers. Let's say that you have a cut on your leg and you're wading through the water of the rice fields. That soil and water could contaminate or could contain the Burkholderia pseudomele bacteria. Also, soldiers overseas. Let's say they detonate a bomb and the bomb kicks up dust. They inhale that dust. Now they also have Burkholderia pseudomele bacteria inside of them. So what are some of the relative risk factors and how is it calculated? Well, for my case study, I was given relative risk factors in Fuquate and also household members in Fuquate. So what I did was that I took column A in the exposed and column B in the exposed and I added them together. So 60 plus 19. Then I took the sum of that and divided it by the 60 in column A. So I'll set that answer to the side. And then I took C and D and added them together. So 16 plus 27. Then I divided it by 16. So now that I have the answer for that, I'll take the answer that I got from A and B and I will divide it together. That gave me 2.05. I also did the same thing for the column at the bottom, the household member in Fuquate. When I did the calculations for that, I got 5.2. So what does this all mean? Well, the higher the number is, the higher the risk factor. So as seen from my calculations, the household member in Fuquate is the highest risk factor than you just being in Fuquate. So this allows us to help avoid possible risk factors that has a high relative risk. So I took that and I applied it to similar outbreaks. What if we did all of Thailand? And how about Australia, since they're in the endemic? Well, as you can see from the calculations, diabetes in both Thailand and Australia is a high relative risk factor. But in Australia, it's a little bit higher with 13.1. Also, your occupation can be a relative risk factor. Not only that, alcohol consumption can be. Your ethnicity, your age, your sex, that can all be relative risk factors. So what is some of the symptoms of melioidosis? Well, some of them are flu-like symptoms. Remember in the beginning when I had that it was the great imitator? Well, melioidosis can seem like other diseases or infections. So the flu, you can have flu-like symptoms. You can even have tuberculosis type symptoms. You can have fever, ulcers on your skin, pain and swelling in a contaminated area, chest pains. You can also have pain and swelling in your muscles and headaches. People with these symptoms think that it'll just go away, but it usually lasts a while. Here's some photos of what it would look like if you have melioidosis. Diagnosing melioidosis can be kind of tricky. Again, you have to isolate it from the patient and put it in a culture, and then identify it. Once diagnosed, if you're still alive, you have to go through a rigorous treatment. Because it's slow growing, the treatment has to be drawn out. So antibiotics are given by IV for 10 to 14 days, and then you'll have an oral antibiotic that you must take for 3 to 6 months. Again, you are not guaranteed to live even if given antibiotics through IV, because remember, the bacteria is antibiotic resistant. Researchers have been worried, and even the military, that this melioidosis can be used as a biological weapon. They are comparing it to anthrax. Because there's no vaccine for it, that means the mortality rate can be very high. So as you can see in my summary, Burkholderia pseudomele is a very dangerous bacteria. So dangerous that the military is looking at it as a biological weapon. Also, cases go unreported because you can get misdiagnosed, or people die just so suddenly that you don't have time to diagnose them, and then they're buried. So as of right now, prevention is the best way to minimize the outbreaks of melioidosis. Also, it's highly important that you get regular checkups. Although it's still in the work, researchers are trying very hard to find a vaccine that will not only cure melioidosis, but just prevent it. Also, researchers are trying to find a simpler way to test for melioidosis, one that doesn't take 24 hours. Here are some of my references, well, actually all my references for images. And here goes the rest of my references for the information that I use throughout the PowerPoint. If you have any questions, please feel free to contact me. Thank you so much for listening to my presentation.